I welcome everyone to the Ann Woolcock Memorial Webinar 2026. I'm very happy to welcome Professor Christine Jenkins to talk about Professor Woolcock. Dr. Jenkins is an international leader in the field of respiratory medicine and lung health. She's the program head for respiratory at the George Institute of Global Health. She's also a professor of medicine at UNSW Sydney, and she has played multiple leadership roles in many national and international organizations. She's also the member of the Order of Australia for her outstanding contribution in the field of respiratory medicine. Throughout her career, she has been a principal investigator in multiple clinical trials in the field of asthma, COPD, and has been an excellent mentor to many young researchers. She has played a leadership role in advocacy for lung health in Australia, most notably as the chair of the Lung Foundation of Australia. She is also the chair of the National Asthma Campaign and the federal government's National Asthma Advisory Group. She has contributed extensively to government advisory committees, clinical guidelines, and implementation initiatives aimed at improving outcomes in asthma and COPD. Her research focuses on the clinical management of airway disease, patient-reported outcomes, and real-world effectiveness of therapeutic interventions. Her current work includes trials in asthma, COPD management, pulmonary rehabilitation across Australia and Asia. I'm very happy to welcome Professor Jenkins to talk about Professor Woolcock, with whom she has worked in multiple settings. She was just recounting some of her experiences before the webinar began. Over to you, Dr. Jenkins.
Thank you so much, Ram, and thank you to the ATS for inviting me to talk about Anne as a prelude to Chantal Donovan's presentation. I know Anne would be absolutely thrilled that an Australian is giving this presentation. She would be immensely proud of you, Chantal, and I know she would want to give her congratulations if she was here. As I said prior to the beginning of the webinar, Anne died exactly 25 years ago. She was one of the greatest contributors to academic and clinical respiratory medicine. She died from breast cancer, aged 61. It was a premature death in many, many ways, and in particular in that she was really at the peak of her academic career, and she was still making, and in fact would have continued to make, enormous contributions to respiratory medicine globally. But she began very humbly. She completed her university education at the University of Adelaide. At that time, Adelaide was almost a small town. She then went to Broken Hill, which is a remote Western New South Wales town, where she probably single-handedly ran the hospital for her first couple of years as an intern and resident. But she completed her PhD at the University of Sydney. She returned and really began a stellar academic career. She was supervised by Professor John Reid, and John Reid was a remarkable physiologist. And he then really gave her the impetus and the basis for her physiologic understanding of airways disease, which really inspired a lot of the work she did, and particularly the work she subsequently did when she did her postdoctoral period with Peter Macklem at the University of Montreal. And she and Peter had a very, very long-standing friendship and a very productive research relationship. She returned to Sydney after that, and she then began working in the field of asthma epidemiology as well as physiology. She developed her skills in physiology and began to support the development of a lung function laboratory for service delivery at Royal Prince Alfred Hospital. But she also began her work in asthma epidemiology, and she broke new ground with that. She not only looked at children who were growing up in areas where there was significant air pollution or significant allergen exposure, but she also went further afield. She went to Papua New Guinea and she did work in the New Guinea highlands. And These sorts of big epidemiologic studies were bold and brave, and they were breaking new ground in many, many ways, looking at the roles of allergen exposure in particular and air pollution in relation to the risk of developing asthma. She was promoted progressively through this period of her life in her late 30s and early 40s. And she became head of the Department of Respiratory Medicine at Prince Alfred. And she also was awarded a chair in respiratory medicine. And this was at a time when there were very, very few women in the upper echelons of academic medicine in Sydney. She subsequently was herself awarded the Office of the Order of Australia, and she was elected a Fellow of the Australian Academy of Science, and that is an exceptional acknowledgement of her contribution. She was dedicated not just to working in Australia, but she began to have a really significant international profile, and in part because of the standout nature of the epidemiologic studies that she did, because they were mapping the way in which asthma develops and the risk factors for asthma amongst children, which then become important in adults. She was also committed to respiratory health in the Asia-Pacific region. She had a big role in beginning the Asia-Pacific Society of Respirology. She really initiated that with Professor Yogi Noguchi in the Japan Respiratory Society. She mentored many outstanding PhDs and subsequently people who had really significant academic careers, people like Guy Marks, Helen Riddell, Stephen Leader, Norbert Brand, Greg King, really major contributors to respiratory medicine much more broadly across physiology as well as epidemiology and clinical asthma care. She was dedicated to patient care at the same time. And so a typical thing for Anne would have been to be overseas at a meeting, speaking, often chairing, really very demanding roles. She'd fly back, virtually all flights internationally arrive back in Sydney at 6 a.m. in the morning. She'd be in the clinic by 8:30 in the morning. We would do a clinic from 8:30 and it usually went all day. She developed an asthma clinic, which I worked in with her. And in that clinic, we would not just see patients ourselves, but we'd have case conference at the end about the difficult patients, the patients that we were challenged by and that we were trying to think through how best to manage them. And she was very equable and sort of really invited people into that discussion in a very big way. So I really learned about Anne's extraordinary sort of dimensions, the dimensions of her asthma care, the dimensions of her research, her extraordinary energy, her commitment, and her innovative thinking. She was a big thinker and she could think very much above the pack. My personal experience of her initially was not promising. I'd submitted an abstract. I was doing my PhD in my very first year to the Thoracic Society annual scientific meeting, and it came back with Anne's red marks all over it. And I had titled it Viral Upper Respiratory Tract Infections Are Not Associated with Airway Hyperresponsiveness in Non-Asthmatic Subjects. She roundly denounced this title as far too negative. I should be saying normal airway responsiveness is preserved during viral respiratory infections in healthy young adults. And my distress was conveyed to her by my supervisor, and she made immense efforts to reach out. And I think that that's how we started. We started by her saying, I didn't mean to discourage you. I'm sorry I did. And you know, that got us back onto a really good footing. And from then on, and I saw it multiple times, she would often berate people for their lack of academic achievement or ambition or far-sightedness. And then if she actually upset them, she would absolutely make sure she got it right again. And in that spirit, she really fostered a huge number of careers. And so I think that, you know, what I'd like to say about her is that she she really epitomizes to me the way in which an outstanding researcher and leader can both achieve clinical excellence, achieve extraordinary academic output. I mean, at the time she died, she had over 300 papers, and that was, we're talking about 2001. The productivity that we might all have now was nothing like as common. I mean, we didn't have much. We'd only just gotten really into having publications online. Australia used to wait for the Blue Journal for 3 months from the time it was published before we got it in our hands. So that going to meetings and speaking at meetings and being able to network was a fabulous opportunity to hear and see what other people were doing. And she just had a vision and I think an outlook that we should all truly regard as exceptional, even now, 25 years later. And as well as that, be inspired by it and think about the ways in which we can both care greatly for patients, inspire new research, achieve great things in research, and make a huge contribution to the community more broadly. So that's really, I could say so much more about Ann. She's still, to this day, I know that many of my colleagues who spent some time with her would say the same thing. When we're trying to chew over a nutty problem, we'd think, what would Ann say in this situation? And I think that's a testimony to the ways in which we know that she brought a wisdom and farsightedness to the things that we even do today. So congratulations, Chantal. I'm looking forward to hearing from you. And thank you very much to the ATS for asking me to speak about Ann.